Welcome to the Mindful Table Talk with Health Empowerment Coach Joanna Mickel and myself, Maame-Mensima Horne, naturopathic doctor and clinical hypnotherapist, where we discuss natural approaches to health and wellness with an emphasis on mindfulness. Today, we will introduce mind body medicine, how we got interested in the field, and some of the science behind it. So, Joanna, if you'd like to get us started on how did you get interested in mind body medicine?
Well, that was definitely a journey for me because I was not aware of the mind body connection, its importance in health and wellness until I was in school in naturopathic medical school out in Arizona, and doing our mind body class actually with I think it was Dr. Jonas, and going through and doing the class that was on trauma. It really hit me hard. I actually didn't realize that I had some trauma in my past that had never been dealt with. And by the end of that class and that lecture, I was literally bawling and crying. And I was like, oh no, what's up? And so it really kind of rattled my cage, as you might say, or however you that figurative language there. And so I had to start exploring what that meant for me because it actually made me not able to really concentrate for a while. My grades kind of tanked for a season. And so anyway, so I had I started reading some books. And then I think, of course, I was speaking to you and you were working on your certification for hypnotherapy. And you said, well, how about we try this? And I was like a little apprehensive because I wasn't familiar, and you get all that, the media and everybody likes to throw off on hypnotherapy. Of course, or actually not hypnotherapy, but hypnosis. You see those things, everybody likes to act like a dog or whatever, and you lose control and all this stuff, which is a pile of poop. Anyway, I mean, they can do stuff with that, but that's if you're highly suggestible. It's not something that is, but anyway. So, of course, working with you, it really, you were able to get me into the place where I was hiding that, in my mind. Because that's the thing is with traumas and a lot of things in our past, we have just buried it in our brain, buried in our memories that we don't really access. And it's there like humming in the background. It actually does create how we respond in our environment, but we are not aware of that piece affecting us. So being that, you worked with me and got me into being able to find that spot in life where I was kind of stuck and walking me through how to deal with it, it really opened my eyes to, that, again, the mind body connection. So that mind body therapy. And then, of course, the books that I read during that time, which was Molecules of Emotion, Biology of Belief, The Body Keeps the Score. I think those were the three big ones that I read. There was another one. What's the gentleman's name? Healings of Persons, Dr. What's his name? That was a really old book from like the 1940s. He's one of the first ones that really kind of got into it. He was a medical doctor that realized, and a minister, so it was kind of an interesting combination, which of course you got that piece there, the spiritual piece, and he started seeing his the emotional piece to health and wellness. So he actually switched out of doing, medicine to just working with people on the emotional side. So that mind body piece. And his was just really kind of talking them through it in a sense and having them explore. So it was kind of interesting to start seeing these different individuals and their different takes on it. And of course, you really opening that avenue for me to see how we can access it. It I think I'm kind of going all over the place with this, but it really honed in for me the emotional mind body interaction that we have to actually heal those emotions to heal the body, in a sense. Overall, that's the arching thing of even all those books kind of came to that same deal. You can try to heal the physical, but if you don't touch into that mind piece, the emotional piece, then you're still going to have those programs in the background running and we'll talk about the science that gets into that piece, and instigating still the physical issues.
Yeah,
So
no,
how about you? What was kind of your thing that drawed it in?
no, thank you for sharing because I think that it's important to acknowledge that for so many people there is that level of skepticism, but then there's also the I guess the miseducation that is portrayed in the media, right? Um,
Right.
I actually was introduced to hypnosis specifically when I was pursuing acting. I
Mm-hmm.
took a class at the Bear Group Theater where I was training. Um, it was on hypnosis for acting, right? Or for actors. And so like before I got into the class, like the first time in my life, I was grinding my jaw, like clenching in my sleep. I was stressed out living in New York City, and some of the stressors of survival were really impacting me. And I wasn't really aware of it. But there
Yeah.
was a handout that was shared with me by our facilitator, and
Mm-hmm.
I mean, it had like things like ways to like decrease depression
Mm-hmm.
by looking up and jumping up and down, like these little things. And it was so funny because I would do it and I would always break out laughing. So, of course, by elevating your mood, it takes you out of that depressed state. But I also found by doing some of the reflective activities that it brought down what I was feeling, the stress I was feeling.
Mm-hmm.
I I don't know if I could say I was depressed, but I know I was very stressed out at that time.
Mm-hmm.
Prior to that, I was exposed through yoga.
Mm-hmm.
I practiced yoga as a child, and it wasn't until after I graduated from high school that I started, not high school, sorry, from college, that I was actually like investing, taking classes. There was a
Mm-hmm.
time when again, I was really stressed out and I probably was very anxious. Like I've never had a diagnosis of anxiety, but like my thoughts were a little bit more amped up and I was really questioning what I wanted to do in my life. I had a lot of fear about about like I mean there was a lot of traumatic experiences that I witnessed or knew of at that time in my life, but like all of the fears that came out of that were at
Mm-hmm.
the surface because of some of the experiences that were going on
Mm-hmm.
in our community. And I went to yoga for like 30 days. I did one of those 30 days for like, I don't know, probably like 29 or $30, maybe even $50. It was back
Yeah.
when the introduction was like really affordable.
Mm-hmm.
And I remember one of the times that I did it, I was so torn as to what direction I wanted in my life. And after that, I literally booked my ticket to New York City, and I was just like, I'm taking this leap. I
Mm-hmm.
didn't really have the foundation to like really take such a leap of faith, but I did it. I moved. I had like, the stereotypical just got two suitcases and you just change your life in that moment. But
Mm-hmm.
like me making that decision was something that I really wanted to do. I was mulling over it for like a few, what I was really frustrated about was like my direction,
Mm-hmm.
but I had clarity that I had these dreams back when I was like younger that I just wanted to explore. And I also just wanted to find myself. And
Mm-hmm.
having the courage that came through having clarity through like a regular yoga practice, that really propelled me in a direction that, I mean, that was the catalyst of me even coming to where I am now, which is
Mm-hmm.
going through naturopathic medical school, doing all the training, because that's when I got exposed to different modalities and different ways of living. So
Mm-hmm.
that is kind of how I got into mind body medicine. And honestly, my interest in mind body medicine was the seed was planted before I got to naturopathic medical school. And I think
Mm-hmm.
taking some of my classes, I remember the health psychology class specifically at the Canadian College of Naturopathic Medicine. That class was the one that shifted everything because I was introduced to different theories, like the attachment theory. I also was introduced to I think a book called The Buddha Mind, and a number of books. I think one was like Dancing with Spirit, but they were talking about addressing trauma. And I started asking, I probably shared this, like I think of my mind as very like scientific method. Like I ask a question to the universe and then I ask for answers.
Mhm.
And then I seek some of the answers as well. And what I kept asking is, okay, according to some of these theories, once you're kind of put in a category, if you're identified as being anxious or avoidant, are you able to shift that? Like, are you really able to truly heal it without being in another relationship that could exacerbate some of these patterns, right? And the
Mhm.
emotions. So my question was, how can I heal this um, in ways that are not dependent on jumping into another relationship that is probably going to trigger some of the insecurities or the
Mhm.
trauma or whatever that may have led to these patterns, whether in myself or in others.
Mhm.
Yeah, that's how I got into it.
Yeah, it's a journey. For me, it's still a journey. And I see it in doing health coaching, how it's really the roots of being able to receive full healing, even to be able to take on. I mean, so I guess part of it I did see in light, but never put the full connection. I used to watch Chris Powell's extreme weight loss, and he would get to the emotional piece of these individuals, and most of them had some type of traumatic experience in life, and so they were utilizing foods as a way to cover it. And so the ones that would actually address those emotional pieces, and he would always, of course, encourage them to seek out a therapist and things like that, would have a better um, result or better uh, success in the program. I think he did have a few that they ended up didn't make it because they wouldn't, explore that part. And I can see it with my program. I kind of have a progression. I do the nutrition, the fitness, and then I do stress management. So within stress management is really that mind body piece. I, of course, don't do it into a depth level. I do encourage, if there are things that come up through this training, that they seek out a therapist. I've been encouraged. I've mentioned you to my clients because that it is beneficial. I have also said it can be intense because depending on what your experience is and what you're going back to, it can be an intense experience, but it was very helpful to me. I will say that was probably, and it really helped my relationship. You were talking about how to have relationships, and I can say yes, because it actually has helped a relationship in my life, where some of the trauma came from. And now I can understand that individual and see the same patterns in them and understand what they're doing. And that, I think, to me, was the most valuable piece of it, is to have an understanding of why that trauma was perpetuated, because of the trauma they had, going into generational traumas, that instigates that mind body piece too. And so to me, I found that so invaluable from that experience. I think that's the biggest thing I took away from my time with you working in hypnotherapy, was to have that aha moment. I mean, right now and it really has me a bit emotional because it brings a love out, and a compassion to the person that hurt me, because I'm like, wow, this is why they did that. And it wasn't that they consciously did it. It's just when you don't know and you've been placed in you just kind of tend to perpetuate it until it becomes an awareness to you. And then that helped me to actually not just, again, like you said, finding another person, are they going to trigger something? Well, now, because I have that knowledge from that experience with you, I can take that same knowledge to other people that may be doing something that could hurt me or trigger me. I'm like, okay, what is their experience?
Mhm.
Where are they coming from? What hurt do they have that they're lashing out? So that I can actually stop the triggers, right? And be more again, compassionate. And so that's what I want to bring to other people is that awareness, that and that's why I do encourage us, like, if you don't know what is the things that's holding you up, sometimes having somebody to help you walk through memory lane is what I kind of like it was, is what you did is you took me through memory lane to say, hey, let's go back and see where it's at. Because of course, sometimes you need a guide through all your trail systems. I call our memories and our actions in our brain, or mappings of the brain, as a trail system. And sometimes when you go on a hike, you need a guide.
Or you may get lost.
You might get lost in all that, you know?
Yeah.
So, that's what I see, I guess, going a little bit more into my experience that brought me into my body medicine, and how, I'm starting to utilize the knowledge that I've gained, the experiences that I've had in mind body work, and to be able to start expressing it to my clients, and why I find it so important that they start exploring some of these things for their health and wellness, because to me it comes down to those pieces a lot of times that holds them back from getting the full healing they're looking for in health and wellness.
No, I thank you for sharing that. It's funny that you say that you're talking about the hiking and having a guide, because when I started on this journey, I started out by myself, right? I thought like everyone was like just trying to get a dollar out of me and all this stuff. And that mentality is what led me to recognize the importance of having a guide, a teacher, a facilitator, a doctor. And it's so important that it's in all of the like, so there's the science, but there's also a spiritual science that also provides a lot of the knowledge, especially because I started in yoga and also study Buddhism, where in both practices the teachings encourage having a teacher to guide you along the process. Like in yoga, if you get a mantra is like an affirmation that you repeat when you're meditating. That mantra comes from a teacher who knows you, who can help guide you, and who can help identify what you need in that moment. And I know for me, I had like friends who had affirmations all over their homes, like in the bathroom, and I was just like, this is crock poop. And there is science to affirmations, but I have found specifically that the teaching of having someone provide that or help you to identify that mantra, that affirmation, is even more powerful, because what it actually is doing is reinforcing the work that like is already started. So like in the work, especially from hypnotherapy, really almost everything that we do that changes behavior. You're creating neurosynapses. You're creating new synapses that are, once they're created, you want to reinforce and strengthen, right? Because our brains, our bodies, everything is information transduction. So it's like you're receiving information through sensory input, and then that information is implemented and sent out. And that can be through actions, behaviors, thoughts, right? And all of that comes from a signal. And so with the work that I do, in our sessions, we are actually creating new synapses by also healing those emotional traumas, right? By providing the emotional release, is teaching people how to express their emotions in a healthy way. But in addition to that, after we kind of consolidate the memory and identify what the old beliefs and conclusions are, we're able to create a new conclusion, because they have that closure of, okay, this is what happened to me back when I was younger, and or whenever it happened. Because some people, like a lot of their trauma starts like in their 20s. It's so fascinating to work with that population, but the majority of the trauma comes later. But the conclusions and the behaviors that come out of the trauma are what has to be changed, because every belief, every thought, every action reinforces that conclusion. So if you
Mhm.
have an old conclusion of not being worthy, our brain actually creates signals through its signaling pathways that reinforces that, which is why
Mhm.
some people, when they look out the world, I'm like looking out the window, when they look out in the world, as I look
Right.
out in the window, and they see the world as a dangerous place because for them, the world is dangerous. And
Mhm.
until that dangerous place is shifted and they can create and feel safe in their lives and in the world, even if it's just in their bodies,
Mhm.
having that new sense of safety reaffirmed regularly is what allows for those the synapses and the neuro, like the, what do they call it? Gosh, my brain. I'm like, ooh, like that allows for neurointegration, but also creating new plasticity,
Yes,
right?
neuroplasticity.
So
Mhm.
that's when we're creating new neural pathways. That
Mhm.
is possible through doing this work. And
Mhm.
I see it happen, and it's like the affirmations, which I was right, what I was discussing before,
Mhm.
without having the transformation. I find it hard to actually have a, like, you're, it's almost like you're lying to yourself. Oh, I love myself. I love
Mhm.
myself. But the memories of when you're unlovable are always coming to the surface. So
Yep.
even the, oh, I love myself, I am beautiful, those things are important, but they also have to have a real foundation, or else it creates it's
Yep.
dissonance
Yep.
within. And I see it happen all the time where it's like, no, I'm being positive. I don't want to address the negatives, but because those negative emotions exist, all that positivity, if anything that is not what someone deems positive, they encounter, automatically they spiral out of control. And it becomes, it just becomes a very destructive energy. Or like
Mhm.
for people who are energetically sensitive, it's like, whoa, you hit a wall. It's like a stop sign, a halt. And it's just, sometimes it can be very jarring because it's like, where's that coming from? But it's
Mhm.
because the false belief of like, no, I'm only going to be positive, with the true belief, which is not positive at all,
Mhm.
they're colliding.
Yep.
Yeah,
Yep.
so
So
yeah.
go ahead.
No, I would just find it fascinating because the personal transformation and healing, like I firmly believe that healing is possible because I've seen this work. And also what you were talking about compassion, like right now there are a lot of teachings that talk about, oh, you don't have to forgive. But in this work, yeah, there are people who are like, oh, I don't
I know.
forgive.
I
And
work with one.
I always am like, oh, because what I have seen is when people hold on to those resentments, it does not result in a positive outcome. It actually like it stalls the
Yeah.
healing until they come to a place where they're like, you know what? I am ready to forgive.
I think a lot of times, at least with individual I've worked with in the past, who would say, I'm never, I don't forget. And I don't say I'm sorry. I don't think I should have to. And I don't think I should have to. And I'm like, okay. But people don't realize, because I think for this individual, it's like trying to show that I'm weaker or that it was my fault or blah, 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 blah. Um, and they don't realize that forgiveness is about you letting go. Because every time you're holding on to that resentment, you're holding on to that anger, you're holding on to that uh, thing that they did to you that you felt was wrong to you, you were always being wronged. You were always a victim. And therefore, you've created yourself for a forever victim. And you're forever tied to that individual. And if you don't like that individual and you don't like what they've done to you, that's not, you're never going to get away, because that forgiveness is not so much for them as it is for yourself. It's for you to be able to say, I'm letting that go now. I'm not going to tie myself down to that anchor over there that's not going to let me to grow, because you can't grow being stuck in that I've been hurt by someone, and then the apology side too is to recognize that you're human, you know, that you're going to make faults and it is okay. You can learn from it. So if you don't apologize, you're not learning from that experience. Apology is to learn from that experience and to be able to move forward. And then that apology is really to forgive yourself for being human, and not taking everything in or allowing maybe a subconscious action to have taken place. Maybe you weren't thinking in the moment. Because that's what a lot of times we just speak without, I used to say sometimes I would just open my mouth and switch feet.
I say that I'm like okay, so I'm like it's like, oh, this is astrological babble, but the stereotype of a Sagittarius is foot and mouth syndrome, where you talk before you think, and then you just say like what comes out is something that is usually like hurtful or not received well
Yeah.
because it just comes out without conscious thought.
Yep. So going on that subconscious, thinking, we do a lot of things subconsciously, and several of the books that I've read, they talk about that we're 85% of the time we're subconscious in our actions, which is really kind of crazy. So yeah, sometimes we just speak without thinking. And when I was reading in the book Biology of Belief, and this kind of went along with what was going on, what I learned from you through hypnotherapy on the individual that I was kind of dealing with the trauma from. And he talked about how we are trained in the first, few years of our life, we're in a hypnotic state. Our mind is. And so, because we have to learn really, really fast. And the only way to learn is to bypass the frontal lobe, which is our thinking filter, right? And so we just take it all in and take it all in, and it becomes part of our subconscious in the background. And so a lot of times when we're not aware of what we're doing and we're kind of thinking in the future or thinking in the past, or we're dwelling on this or dwelling on that, and somebody comes up to us while we're not in the present, because that's when we're thinking outside of the present, we're not conscious. So our actions for the present are not even there, and so we can end up doing something that we didn't realize we are doing. We're actually acting like whoever taught us that action or response, which could be a parent, could be a grandparent, could be something we watched on television when we were young, and we're not even aware of it. And I had this interaction with a parent of mine, and she was, well, that would have been my mother, but my mom. And she was mad at my dad. I mean, she was just livid. He had ticked her off. And so I was going out the door and she was coming in the door. Well, I was in her way. And so she just hauled back and smacked the crap out of me, just wham, and just kept on going. It broke my heart. I was crying. I was like 16 at the time, and never apologized during that time. Didn't even. It was like it wasn't even. She was in there, and she wasn't. And when I read that book, I could, and of course, even dealing with that, I could see that was a subconscious, it was her father's response, because that's how he was. And so she was just acting in the same vein that she had been taught. And so it was just like, bam. And I just happened to be the one in the line of duty or whatever, in the line of action. And so it helped me to go back on that, because that used to be one of the things that I've kind of had a wall against. And to realize that was not her, that was my grandfather going through her to do that. And then I had to recognize myself, am I doing that same thing and perpetuating that same kind of response? When I get angry and I'm not in in my present, am I lashing out to people in that same vein? And I have seen myself do that. And so I had to stop that. So you have to, when you recognize these patterns, you have to become conscious to stop those patterns, so it doesn't perpetuate. And, because the reason we have to learn in a subconscious state and it becomes subconscious is for survival. That's just the way we're developed to survive. Unfortunately, we're taught ways that weren't very nice to survive in a sense. And so when we get later in life, we have to go back and go, okay, is that programming correct? No. And that's what gets us into the mind-body piece of health and wellness, is going back and having to change that. And that's what I talk about with my clients is, okay, guys, how are you responding? And is that, you got to take an inventory at the end of the day on what you did and when you got upset and say, is this really a beneficial way for me to respond? Because I'm responding a lot of times subconsciously. And if it's not the right program, like you were talking about, and I go back to my little maps in the brain, my trail system, I call it. Um, and that's the neurological pathways you're talking about. You have to redo those pathways. And so some of the easiest ways to do it, from my research, and I'm sure from you, is hypnotherapy is one of the ways that you can actually help to recreate pathways that are better suitable for you than going down this one that's going to go out and lash out at people, as opposed to say, oh, let me just let me get reestablished before I respond to you, and rather than, I don't want to talk to you right now. Sometimes we do that. It's like, oh, this person, I'm not ready to talk to you right now. Just
Yeah.
or whatever that negative response is. So that's, kind of what I see a lot of times, like you say, with that subconscious. And it's really made me be more aware of how I respond. Sometimes I still switch my feet.
Well, we're human. I
Yeah.
I found a beautiful visual that I like to use in some of my teaching. I don't know if you can see that,
Yeah.
but it talks about exactly what you were talking about. So for me, I was taught that the conscious mind is only 10%, right? So that's our analytical thinking and planning and our short-term memory. And as you can see in the visual, that's like an iceberg, and the tip of the iceberg is literally the conscious mind. And
Mhm.
then everything else, which is like 90%, is within the subconscious mind. And that's where we have, well, subconscious and the unconscious mind.
Yeah.
And as you can see, there's so many things like the emotions and feelings, our habits, our relationship patterns, addictions, the
Yeah.
involuntary bodily functions. So, like just going to the bathroom when you gotta go, creativity, our developmental stages, as you were talking about earlier, where you're learning from that subconscious state from the first 6, 7 years of your life, our spiritual connection, so our ability to have faith and our intuition. That in itself, we don't even recognize how deep beneath the conscious mind that is, and how our brains are using more to access those aspects than just the 10% that is used in the conscious mind. And that doesn't even get into what's in the unconscious, the archaic memories, the instincts,
Yeah.
our karmic patterns, the
Mhm.
dreams, our collective development. So all of the things that are like transpersonal, those are the
Mhm.
things that we see at the unconscious level. So putting
Mhm.
that together, the subconscious and the unconscious, we can see that like majority of our mental experience and capacity is literally happening below the surface. And
Yeah.
what is at the surface is so minuscule. So like
Mhm.
you were sharing with your mom, and I mean,
Mhm.
I think about some of my own personal experiences with my first family, like my parents and my siblings, where
Mhm.
some of the things that, I've worked on healing
Mhm.
occurred because of the law of the things in the subconscious. So yeah, I wanted to share that visual because I felt like it kind of
Yeah.
represented and really brought a full picture of what you shared and how this work is crucial.
Yeah.
When I'm
And
talking,
that's,
oh,
oh,
sorry, go
sorry.
ahead. No, go ahead.
I mean, that's what it comes down to is being able to, for people to recognize there's so much more to the mind with that visual that has, you have to have a guide sometimes to go into those areas, to find those things. If you're, you can try, there are some exercise. They do have self-hypnosis things that they, classes you can take that can help you there. I like journaling. Sometimes when we just write freely, things can come up and you can start, grasping into those areas. And I've seen, again, working with clients and different ones, and even just having these conversations with my parents and my mother, I've seen her, be able to start recognizing some of those patterns. And she did actually eventually apologize for that episode. So we were able to heal a lot of that by being able to speak and to talk to these types of things. So I love, that we can make people, start learning from one another and sharing. So like I said, it's really been a great way for me to recreate a better relationship with individuals on this understanding that, there's a lot more to somebody than the 10% we see of their conscious, things that are going on.
Yeah. I think that visual also helps to understand why bringing like the things that come to the conscious mind, right?
Mhm.
For some people, like when you have, well, for most of us, when we have unresolved trauma, like things start popping up, whether through
Mhm.
dreams or like just
Mhm.
thoughts or emotions start coming up.
Yeah.
And we're not always aware of where it's coming from, just like you were saying with your mom.
Mhm.
Like, and you can see
Mhm.
it, like somebody getting upset, and it's not about, it usually is not about what the situation is that we're
Mhm. Right.
witnessing. There's usually
Mhm.
so much underneath that
Yeah.
that is
Right.
carried with that emotion
Mhm. Yeah.
that is, you know, I want to say coloring that experience. So it goes back to, if you don't feel safe in an
Mhm.
interaction, all
Mhm.
of the other times that you felt unsafe come with that. And then all of
Mhm.
a sudden you're defensive, or you're this or you're that.
Yeah.
And then it's not about, okay, this person's triggered and there is possibly something that I am doing to trigger them.
Yeah.
And they're like, for me, it's like, now that I've done this work, I'm very aware of like what you said about
Yeah.
being in the victim consciousness, right? That
Yeah.
mentality.
Yeah.
Unfortunately, it is a cycle.
Yeah.
It is a cycle where, someone may be a victim in a situation, and
Mhm.
then there is a persecutor. Sometimes the victim
Mhm.
becomes the persecutor where they were abused and then they abuse others. And
Yeah.
then there's usually someone who's trying to save them, the savior.
Mhm. Yeah.
And sometimes one person can go through all of those experiences, and
Mhm.
and once you're aware of it and those behaviors and that cycle, it becomes easier to
Mhm.
make a conscious decision to say, you
Mhm.
know what, I am not going to feed into this experience anymore. And
Yeah.
I'm going to remove myself from this cycle. And any
Mhm.
time that I'm being pulled back in,
Mhm.
I can make a conscious decision as to how much of myself I give or get into this. But
Mhm.
it is recognizing that a lot of the behaviors that lead to the victim consciousness, and they're based off of
Mhm.
experiences that are
Mhm.
true, that have happened.
Yeah.
And those experiences have to be healed in order to make that conscious decision and stay off. But because we're human, like,
Mhm.
it's hard. There are times where, especially if you're in the healing professions, there are
Yeah.
moments where it's like, okay, like, I know that I have certain boundaries to protect myself from being pulled into certain experiences. But
Mhm.
because we're human, and especially if you're compassionate, you may find yourself being like, hold on, how do I
Mhm.
handle this? What do I do? How do I maintain my role or myself? Really, it's myself, my love for myself, and still be able to be of support to another.
Mhm.
So, like, that came because when you were talking about how your experience made you more compassionate, what I found in doing this work over, I'm like, oh my gosh, it's like 6 years now that I've been doing it. I have
Mhm.
found that my patients and clients become more compassionate. And
Mhm.
even if, there's resistance, and resistance comes in different ways, it can result in conflict, or it can result in like avoidance, or it can result in so many ways that it unfolds. But
Mhm.
despite all of that, if we can get through the process to the end, what I have found is that self-awareness, where compassion coexists with everything else. And
Mhm.
it's one of the philosophies that, I know I live by, is to try and do not just for myself, but do for the sake of others with that understanding. So, being able to really step in another person's shoes,
Mhm.
it wasn't until I started doing this work that I've become aware of how people's traumatic experiences, and they don't have to be like big trauma.
No.
They could be
Right.
little traumas, right? Because
Mhm.
really there's microaggressions that happen. There are all kinds of experiences that we have in our day to day that
Mhm.
may trigger not just an experience with that we have, but maybe our ancestors. And I remember when we
Mhm.
were in ND school together, um, there were moments where, being a Black woman in America, and it was during the around 2020 that we were in school,
Mhm.
there were a lot of racial tension.
Mhm.
And I'd already started doing this work. So I was like, I was healing a lot of that experience. And I kept asking myself, is what I'm feeling, is it racial tension or is it just like this person has their own trauma and
Yeah.
it has nothing to do with my identity? It just is a
Mhm.
them problem.
Yeah.
And it's interesting because navigating at that time and having this framework and experience
Mhm.
made me aware of how easy it is to get sucked into a spiral
Mhm.
of ancestral trauma or collective trauma, where
Mhm.
something that could be, and I'm like, we could take a poll on it, and
Yeah.
maybe, it is what I think it is. But
Mhm.
I stopped trying to label things in that way because
Mhm.
it allowed me to see human beings for being just that,
Yeah.
imperfect, and we have our own prejudices
Mhm.
that drive us. And until we heal those experiences, we continue to perpetuate the same cycles.
Yeah.
So, yeah, I don't know. I mean, I love mind body medicine in general, and
Mhm.
the work that I do specifically and the training that I've received and I continue to do to integrate into my work
Mhm.
allows me to not just be compassionate, but to also help other people to open up that space of compassion.
Yeah. I liked what you said, how when you go into an experience, going back to that video, that image you did, is that experience is a compounding. It's not that it's just that moment's emotion response. It's actually that and everything behind it. When you get into those perceptions, like saying, having the, like you're talking about beliefs earlier with the mantras, you can say a mantra, but if it doesn't align with the belief that's underneath, it's really kind of lying to yourself. Until you get that belief changed, then the mantra is going to mean something. But at the same point, if you go into something, then that underlying piece is that person is just adding to it. Like if they wronged me and I'm just not worth it. And so that's why they don't show me any worth. And then and it gets bigger and bigger, and those responses get bigger and bigger. And, some people are like, oh, they're so out of proportion. Well, yes, what is behind that proportion is not just that moment, it's all the moments in conjunction, because we didn't heal all the prior ones. And if we don't heal those prior ones, it'll compound and compound. And that's why a lot of relationships fall apart, is because they're just compounding the problems. Like you said, the micro traumas become bigger traumas because we haven't healed the other, what you call little traumas. They become bigger and bigger and bigger and bigger because we're just compounding them and shoving them in the back room you know and that's why it makes it so important to do the mind body work and healing, so that we don't have those overreactions, which actually of course leads us, want to get into the science of it, because I'm all about physio, is what happens inside. Hypertension tends to be one of the big ones. We can end up with autoimmune conditions because we're compounding and we're compounding and we're compounding, not taking care of them. It's like, in Chinese medicine, one of them is liver qi constraint. You can see it in the tongue, just people holding it all in and not releasing it. And the body's just getting tenser and tenser and tenser. And then they wonder why it's, um, you think about cartoons and they go out the side. You see that with, that's liver young rising. If you want a cartoon visual,
Yes,
that's a
yes.
cartoon visual of liver young rising. Um, but you know, I know that's probably one day we're going to get to some of the Chinese medicine and stuff like that. But anyway, but we have to be able to deal with those little things to be able to. So as far as the science, when you make a thought, you're releasing neurotransmitters, and those neurotransmitters go out. And I like to kind of think of neurotransmitters like if you ever go to get you a paint at a paint shop. They put a few drops of the blue, a few drops of the red, a few drops of the yellow to get whatever color it is. If it's like bubblegum pink, you have to have a little bit of everything. And then you have bubblegum pink to put on your wall. Well, that's how our moods are. I have a little emotion wheel over there in my little bag that I have. There's 144 different emotions just on that color wheel or that emotional wheel. So think about a color wheel. Each of those emotions is a color. Well, our brain does that. It creates a color, you could say, or an internal environment color. If you tell somebody, oh, I'm sad, what color is your sad? There's a different spectrums of sad because we have, completely depressed, you could say a dark blue, as opposed to I'm probably a teal blue. There's a little bit of peace, just kind of a bittersweet sad, and that's how the body does it. We have these different amounts of neurotransmitters that creates an internal environment, which creates then hormones to respond. So if you look at this and we're creating, that blue is getting deeper and deeper and deeper and deeper and deeper because we're adding those microtrauma, those hormones are getting more and more and more. And that's what creates the internal environment that can set up for chronic illnesses. And that's why we want to go back and fix those microtraumas so we can take the blue back up to yellow. Of course, some people might see yellow as different from me because I see yellow as happy, sunshine and rainbows. And have the happy ones that make you healed and happy and full of energy. And so that's kind of a high level look of how, why the mind and body thoughts, or you create the traumas or you reperpetuate it. You're creating those neurotransmitters that create the hormones, and hormones tell your body to do something. And then that, if it's like turning on a spigot or turning off a spigot, turning on a light bulb, turn on, and if you leave something on too long, like, one of the things that I like to do for, diabetes is like you put a plug in a sink and then you turn on the faucet. So the plug in the sink is you got insulin resistance. So it's not taking in sugar, but you turn on the faucet, which is letting in the sugar all the time, and it overflows. So you got to take the plug out and you got to turn off the faucet. And then you can clean up type 2 diabetes. I mean, that's a very simplified way of looking at it, but that's kind of the same deal with anything. It's turning on faucets and putting in plugs, and you got things overflowing, and like blood pressure, starts elevating because we're still thinking we got to fight somebody. We never fight anybody because that's what blood pressure is about, is to move everything to exterminate. And you can just pop somebody upside the head because they're in your space and they're threatening you. And so you have to, keep yourself, protect yourself. Back in the day, well, let's say we pop the bear because the bear, your enemy at the time, so to speak, to survive back in the day when we were hunter-gatherers and stuff. So you had to have that elevated blood pressure so that you could really, run away really fast or, fight off the bear. Nowadays, we don't do that, but we're continuing to add to that fight or flight every time with those microtraumas. And so that's where we end up with the hypertensions and the type 2 diabetes and the cardiovascular disease, hypothyroidism, the list goes on and on and on of the chronic illnesses that develop from not being going back and taking care of those, emotional traumas, whether they be small or whether they be great. And, and again, depending on, what level you're at, what type of therapy is going to be the best for you.
No, I appreciate you sharing that. I was reading, it's called The Psychobiology of Mind Body Healing, and one of the chapters talks about the hypothalamus, and
Uh-huh.
it's written by what's his name? I think Rossi, Ernest Lawrence Rossi. He's a medical doctor who I believe actually practiced clinical hypnotherapy back in the days. But he's done a lot of him and some partners did a couple of books on mind body therapeutics, and then the psychobiology of mind body healing. And I think amongst others, but they were like really big on the psychoneuroendoimmunology
Oh
um,
yeah, yeah.
very early on. And they like his works I are foundational to the field of mind body medicine and neuropsychiatry because of the
Hmm.
research and the way that they're able to collect and put things together. And he does a great job of digesting some of the like the stress adaptive, general stress adaptive
Hmm.
syndrome, and how mind body medicine actually results in a different way of understanding that that how general stress impacts the body. But one of the things that
Hmm.
he was talking about is how the hypothalamus, sorry, I can't talk anymore. The hypothalamus is a part of the limbic system.
Right.
It's a
Hmm.
part of the autonomic nervous system. It plays a part in the immune system. It plays a part in the endocrine system, and then also the neuropeptide system, which results in some of the neurotransmission signaling, right? So when we think about the hypothalamus as a part of the brain, I I
Hmm.
know in how I learned
Hmm.
um, it wasn't until I synthesized because you learn about the HPA axis, you
Right.
learn about how the hypothalamus it secretes its hormone to the pituitary gland, and then the pituitary gland secretes its hormone to the target organ, and then the
Hmm.
target organ does negative feedback, or maybe it doesn't, right? So when
Hmm.
we're looking at the hypothalamus, pituitary, and the adrenal system, which is really the axis, endocrine axis for hormone secretion, when we're looking at how cortisol, for example, impacts even insulin, or you're talking about diabetes, that's a
Hmm.
major issue because what I've seen clinically are people who have insulin resistance who do not have physical the physical body type that you would
Yeah.
expect. But when you talk to them and you do a proper intake, they have high stress.
Hmm.
They may have a lot of anxiety, or they have an emotional experience or trauma or strong reaction that they never got over. And that feeds, I mean, the beliefs just keep on going and the thoughts, right? That feed. Some of them are very angry, kind of like hot to what is it? Yeah, quick to respond, quick to fight, quick to get at you. And then some of them it's
Yeah.
more like they've got the racing thoughts. But what they
Hmm.
have in common is that the stress over time, whether it's the physical, emotional stress, whether it is work related or emotional stress, the
Hmm.
stress is what causes their insulin resistance. And until the stress and the emotions, especially anger, when that is addressed and learned to be expressed without it being suppressed, because the suppression of
Hmm.
our emotions, when we look at homeopathy, right? Homeopathy,
Hmm.
even Chinese medicine, all of the old medicines, they talk about emotional suppression being the cause of disease.
Yep.
So, or one of the main causes of
Yep.
disease. So,
Yep.
if we're looking at it from that perspective, I've seen that. I
Hmm.
see that even this week I saw it. And it's like,
Yep.
okay, yeah, I'm excited to do this work with a patient because
Hmm.
I know that it's not only going to impact their blood sugar regulation, but it is going to have an impact on their blood pressure. And what I found is that there
Yep.
are people who have hypertension, but hypotension is another thing because you have to think about it from how their nervous system responds. You
Right.
have the fight or flight, but you
And the
also have
freeze.
freeze. Yes.
Yeah.
And the people who freeze, it's like the thought is, let me play possum. Like you can, I mean, I
Mhm.
said this to a patient like a year ago, and I just kind of sometimes things come and I feel like I'm channeling and it just comes out. But I was like, it's kind of like if you played possum, what's going on? They kept on having like their blood pressure would drop. It was like 70 something over 40, and they were still alive. And it's just
Mhm.
like you play possum and you just hold your breath and you breathe really slowly. And you're like, if I don't move, they will not hurt me, they will
Mhm.
leave me alone.
Mhm.
And we see that out in nature. If you play dead, you know, a lot, you may survive another day.
Yeah.
My cat, like I try not to be harassed in the middle of the night with my cat. I like cover myself in blankets and I don't move. And I'm like, if I don't move, she'll leave me alone. She'll bat me a couple of times and then she moves on. That's essentially what happens,
Yeah.
even in moments of like traumatic childhood events. And
Yeah.
so those traumatic childhood events, on a serious note, actually like it causes hypotensive reactions as the person's older. And until
Mhm.
the emotional trauma is resolved, then you're having the same like there's
Mhm.
a physical disease
Mhm.
that manifests that can only truly be resolved when the emotions are addressed.
Mhm. Yeah.
Yeah.
That's right.
Yeah, so I mean, this medicine is it's very powerful, and I know that we kind of got going. I feel like this is a subject that we have to continue to explore
Yeah. I mean, there's
because
so many ways to avenue and to look into it. I know with my program, I do a 13-week stress management, and we talk about different aspects of how our thinking, our perceptions, our experiences, all of these play a role in our health and wellness, and our biases. Some of them that we didn't even realize we had. You had mentioned, the racial tensions of the time. And I think a lot of times, people want to, being a Caucasian, I don't have those biases. And I had to explore some of those. My upbringing, I was in an area that was more prevalent with African Americans, and so to me, I didn't even recognize the until I moved away from there, the minority aspect and the what is it the contingencies between races until I came to North Carolina and saw it because I wasn't. I was like that. But then I noticed I did have a bias to another race. And I was like, oh, where did that come from? I do have it there, but I don't have it here. And so I had to start checking in. I'm like, why is there? And then I thought about it. So in my hometown, so I'll tell you, I had an issue with Hispanics, and I didn't realize I did. But now that I look back, and it's actually coming to me clear even now, is at the time we had a lot of Hispanics were the ones that worked on the farms there. They were migrant workers. And I think the society of that area was, oh, they're lower because they're migrants. And so it subconsciously put that into that is where that came from. And I had to reckon and check that bias and say that's societal, and I don't want that. To me, everybody is is the same. We're equal. You know, I don't want to have that and I don't want to feel that way, and I don't want to express that to other people. But I realized it was causing that in me. Um, I did get during the racial tensions, which I do believe was there. It kind of made me feel like it was tearing up my friendships, though, with my uh, friends. I think we even actually had a conversation about this one evening, didn't we not? Where I was like, I don't know what it's all. It was like it's making me feel like I can't really be close to my friends, you know? Because then I'm like checking up, did I say the wrong thing? Did I do this? You
Yeah.
know? But it did help me to recognize other areas where I did have more of that contention and I had to check up on myself. And I think that's a good thing. I think that's another part of of the mind body peace is being able to explore ourselves, get to know ourselves. Because I think we go through life a lot through life, not knowing who we are, not knowing, who we could be. People think, oh, and I've had this mentioned a lot of times, oh, we can't change anybody. Well, no, we can't change anybody, but they can. Or
Mm.
that, and then they say, well, I can't change myself. That's just who I am. Well, do you like being that way? Would you like to be around a person that's like that way? And I've seen myself change. I mean, I'm completely a different person than who I was, I could even say 5 years ago, you know. I mean, just my experience, again, going back to my experience with you with hypnotherapy changed me already. I mean, that was another complete change in me. Again, when you become more compassionate, it changes who you are. It changes how you see the world around you. Um, so, I don't want to be a person that's the same person I was yesterday. I want to be an evolving and adapting and becoming a better person. I mean, I'm a Christian. So, to me, I want to be Christ because he was, you could say for my faith is the ultimate because he had compassion for others. He laid down his life for others, you know, and and so I think even in Buddhism, it's about evolving into becoming a higher
A
being.
bodhisattva, a compassionate, to be a servant of compassion for
Yeah. And
others.
so,
Yeah.
yeah, and that's what really life is about is living for others. That's what gives it purpose. If we live for ourselves, it's kind of boring.
It's funny, I will say, like, I feel like that time did bring us closer together. And
Mhm.
it taught me that I can be my authentic self
Mhm.
and be accepted by people like yourself who are like maybe the opposite. For me, not the opposite, but like, you look the opposite, our spiritual beliefs are the opposite. And for me, it's funny. I grew up in the South, but in the Midwest,
Yeah.
in the Bible Belt and the extension of the Bible Belt. And
Mhm.
from a very young age, I was exposed to different spiritual beliefs. And
Mhm.
I always kind of leaned towards like what I learned is Buddhism. I
Mhm.
didn't have, well, I learned about it in school. I was like, oh, I like this religion, but I didn't really like practice. But as I got older and I could articulate, I knew that I wasn't Christian, even though I lived in a Christian majority environment. And I struggled with my spirituality and my spiritual identity because I felt like I always had to assimilate who I
Mhm.
was in order to be accepted by the greater community, especially being a Black Southern woman, where, Christianity is such a big part of our culture.
Mhm.
So it was, I would say that like during that time and just our friendship in general and the healing that I was doing to kind of really uncover the aspect like at the core, who am I, right? At the core, what is underneath who I am? And also as a doctor and when I was a student intern, having I attracted most of my patients were religious. One of my friends, she jokes like you can go and treat anyone who's super religious, whether they're Christian or Buddhist or Hindu, whatever their religion is,
Mhm.
because that was who I attracted. Like many of my patients were people who were proudly Christian, and we
Mhm.
would still talk about our spiritual foundations that allow us to do the work that
Mhm.
I propose for them. Because what I found is if we, like when I work with my patients, I always lead with what do we have in common? What are our common
Mhm.
goals?
Right.
Right? And so for me, I talk about the five precepts of Buddhism, that, and I relate it to the Ten Commandments and how I'm committed to not stealing and being honest and other things that are at the foundation of, and not harming others, not being violent, right? So
Mhm.
those are like the foundations of my belief. And so when I share, hey, I know you've never met a Buddhist before for some of my patients. I'm
Mhm.
not going to convert you because I respect you as a human being. And, I respect your spiritual beliefs and I want to honor who you are. And honestly, the work that I do, my goal is just to bring you closer to your divine connection, your spiritual connection, whatever
Mhm.
that is.
Mhm.
Because I found that through this work, I've been able to become clear on my connection as a spiritual being and
Mhm.
understand that there's a lot of experiences that happen in life that can tear us away from who we are at our core, right?
Mhm.
And at our core, we're all energy.
Mhm.
And I saw that. I mean, I saw that, like, I guess I should say trigger warning, but like when when I took a year off of school, I watched my cat die. He like had an accident and then he literally was bleeding. And I could see his vitality.
Mhm.
Like, mind you, I took him to an emergency. I took him to the vet, and
Yeah.
unfortunately, the medications that he was given at the vet actually accelerated his decline
Oh,
because those medications were not supposed to be given if there is the potential of bleeding.
mhm. Mhm.
So I noticed that he was declining, and I saw his spirit literally like leaving. And something, I was like, oh my God, I think, I was like, I'm pretty sure that something's happening right now. And I took my cat back to that vet.
Mhm.
And of course, he passed away. But like being able to see how his soul to be okay, so to lead up to that, I did have a weird dream like the week before
Mhm.
where he and I were together and then something separated us.
Mhm.
And I like literally had I known what I would, knew, I probably would have had I wouldn't have, reacted. I think I reacted with spiritual awareness, but it's just like I'm very clear that the soul is eternal, right? And
Mhm.
that we are soul and we're able to that is life. That is who we are. It's not necessarily the physical vessels.
Mhm.
So I feel like during this healing work, even though it is mind body, it's really mind body spirit or mind body soul, depending
Mhm.
on everybody's different on how they can connect to the idea
Mhm.
of the soul versus like spirit.
Mhm.
And seeing the Trinity, that full connection where the mind, body, and our spirits are all connected.
Mhm.
And in that connection, we're actually able to see and acknowledge the divine in
Mhm.
another person. So,
Yeah.
I mean, I find that this work is transformative because no matter the person that I've encountered, if they're committed to the work, their compassionate nature, and what we call in Buddhism, they call it the Buddha nature, the compassionate nature that exists within all of us
Mhm.
becomes more evident because we're learning to forgive and we're learning how to heal and to express and to walk in other people's shoes because we understand that we were hurt and it's interesting because as adults, the adult person is always like, oh, well, it's like intellectualizing. Well, I don't feel that way anymore. But it's like
Mhm.
that wounded child definitely felt that way. And that wounded
Mhm.
child, I mean, have you seen a vindictive 5-year-old? They will take you out sometimes. But that energy of that child that's hurt and wounded, that is what we are healing.
Yeah. And I don't think people realize how strong again, in those first 5, 6 years of life, that is establishing the way your lens is for the rest of your life if you don't go back and address it. And, again, that compounding. And so you have to go back to that child. I know when I did the work for a different trauma than what we worked with, um, I actually did this one by just kind of having some communion with my sister, speaking with my sister and stuff. And I was just meditating on the situation that I had to go back to that child, that 5, 6 year old, and because I blamed myself for it. I didn't blame the person who did it. So the trauma was more on me,
Mm.
um, that I allowed that to happen to me. And I had to look back and say, she didn't have a clue. That 6 year old didn't have a clue. So
Hmm.
I had to look back at the 5, 6 year old and go, I forgive you. I'm sorry. And I have to forgive me for blaming you for allowing that to happen. You didn't have a clue.
Yeah.
So why are you upset? So I forgave myself and apologized myself, the different stages of who I was. And that helped me to actually be able to release that trauma and be more open with myself, because it really did hold me back. I mean, I'm still single, but that was kind of the thing that was holding me up, was how I saw myself allowing things to be done to me that, I didn't. But I was a child that knew. I'm like, I know better now. I'm an adult. But because I think what it was is I didn't trust myself, because I saw that as being, whatever. And so when I can see that, um, and forgive that small child in me, that hurt was gone, resistance of who I was, or, that I would, do something that I didn't want per se, was gone. So, I mean, that's exactly, if we don't go back and address those things of that child, and then, yeah, those emotions are still there. And you think, oh, I'm an adult, I would never act that way. It's
Yeah,
again,
we
the
do.
underside of that,
Yeah, we do. We
that
do. And
iceberg.
sometimes we don't. It's weird because the other side of it is sometimes we avoid, right? We
Hmm.
avoid what we want because maybe we don't trust ourselves if we were in a
Hmm.
situation,
Hmm.
which happens. And I appreciate you talking about the importance of like in healing, of forgiving the self.
Hmm.
I do find that a lot of people who have like really I would say like severe childhood that the adverse childhood events that are more severe
Hmm.
have they take on responsibility and a sense of duty. I know for me it's I have that same sense of duty, and it played into my relationships when I dated because of the death of my little sister when I was about 4 years old.
Hmm.
For me, I saw that I wanted to, I'm named after my parents' mothers. So
Hmm.
that desire to mother my mom, especially, and help her through this hard time. At 4 years old, I took on the responsibility of taking care of my mom. And of
Hmm.
course, if you, I see myself as a very compassionate person. And there was even, my name is Maame-Mensima, right? Mommy. There was a period in my life where I wanted to change my name. And I was like, I'm going by Efwa Mensima, one of my middle names, because I wanted to release the mothering nature that I was literally born with because it's my name, and take on a more fun, creative aspect of myself. The wild part about it is I could never remember that I changed my name. I told my mom, I was like, I'm changing my name. And don't call me Mommy Mensma. I am Efwa Mensma. And like the next moment, I'm like, oh, what's your name? Mommy Mensima or Mommy? And it's like, yeah, like, I guess the subconscious was like, okay, you're not supposed to remove that identity. It's who you are. But
Yeah.
like, that sense of duty was so heavy, and I chose it as a young
Mhm.
person, and it impacted how I interacted because I don't want to mother I'm not trying to be
Yeah.
somebody's mom, you know,
Mhm.
let's be
Yeah.
real. So until I mean, I guess I'm also still single, but until I healed that,
Yeah.
I find that in my relationships, because
Hmm.
I feel like I'm single with a choice. It's like a
Yeah.
choice to be
That's
single
great.
because
Hmm.
for me, I know my worth. And I know that until I meet that embodied
Hmm.
in the reflection that I want, or I
Hmm.
it's not even reflection I want, but like unless it's embodied, I'm not going to just, especially when I do this work.
Yeah.
Like if I'm teaching people about how to have healthy relationships with their selves,
Hmm.
there's no way that I'm going to compromise my beliefs and have unhealthy attachments at this time in my life,
Hmm.
because when you know better, it should manifest in your actions.
Yeah.
So I think it is amazing that you were able to hold space for yourself
Hmm.
and do that work, because
Hmm.
I know that regardless, the relationships, and I even look at our friendship,
Hmm.
our
Hmm.
relationship, when we do the work and we heal those traumas, no matter what they are, they deepen the level of intimacy and connection that we have with our friends, our families,
Hmm.
and that creates the space that we can have and attract healthy and intimate relationship with another, because we've done the work.
Yeah. I mean, that's the thing if you're going into any, relationships, I know we're kind of getting on a different topic, but it's still with the mind body, because is that if we don't heal ourselves, we're taking on and we can perpetuate pain in others and that creating other traumas. So really, having a healing before if you're looking for an intimate relationship and things like that, is to take in and say, okay, what things do I need to take care of so I don't perpetuate? Like, I'm going to take it to the book I was talking about, Biology of Belief. He spoke on this himself. Dr. Bruce Lipton, his family, when he was a child, he had a father that wasn't the greatest, and it ended up causing his parents ended up getting divorced, and they didn't have a good family life. And that was his desire. He wanted to have a good family life. He wanted to get married, and et cetera, et cetera, and live happily ever after. Well, the happily ever after only lasted through the honeymoon. And sadly, his marriage fell apart, and he had to stop and reflect. And he remembers, her saying, "You're acting like your father," and he hated to hear that. And when he really sat down and he looked at it, he had not healed, the things that his father had instilled in him, of course, from his, and he was just being perpetuating his father, because he was trained as his father on how to respond in a marriage and those things. And then not being, during when he was saying, when you're in the honeymoon phase, you're in that forebrain, you're in the present moment, but then life happens, and things become mundane and routine, and you fall back into those things that were in habit. And so he had to realize, after that marriage fell apart, that he had to do the work. He had to go back and heal those things and reprogram from his father's, ways that got kind of ingrained in him, and all that stuff, so that he could have a healthy relationship that he wanted. So he realized, to have that, what he desired, he would have to do the work and the cleanups, and so that's some of the things, I think we've, in one of our classes, I think we've even spoke of it, in school, is, if you're going to go into these things, you have to, it's same going into being a physician, they always say physician heal thyself, is that you cannot heal others if you're still carrying wounds with yourself, and so it has been a healing journey for me. I know, going to school and doing naturopathic medicine, then moving into Chinese medicine. And it's I know I think many people that's known me over the years has seen the changes I've made, from what I was years ago to who I am today. I mean, definitely, I was my family used to call me the nun.
I can relate.
And now I'm not so much that. I'm not quite the legalist, hard edge. What are you doing?
Yeah, I feel like
I'm
we
gonna
all
get
kind of go through, well, everyone goes through their own, I guess,
rhythm.
experience. Yeah,
Yeah.
we all have our archetypes that we kind of pull into and play into. And it's because I think because we share that the spiritual, our spiritual fabric is such a important part of our lives that
Mhm.
that archetype of being the nun, kind of, and there's no like, I respect the life. It's funny when you brought that up. One of the things I am a part of a lay Buddhist um, temple, and I expressed to the head temple staff, he's an ordained monk. Well, I don't know if he's like an ordained practitioner. But
Mhm.
I told him that I didn't want to be a nun. And that was
Mhm.
my rationale for choosing that spiritual path out of like a more
Mhm.
traditional Buddhist path. Because I like my spiritual beliefs can just, I can go into them in the material world, like, it just is what it is. So I definitely like resonate when you shared that. But also when you were
Mhm.
talking about Rosie wants to say hi. I feel like she always likes to make her cameo appearance. She cannot not do it. But when we were talking about the importance of doing the work, and you were sharing from the biology of belief
Mhm.
and Dr. Bruce Lipton's experience, in one of my workshops, Cultivating the Inner Glow, where I focus on healthy relationships and sexuality, one of the things that we talk about is that you attract, and sometimes a lot of people marry the person in their first family that they have um, energetic dissonance with. So unless you heal, it's like, oh, I don't want to marry anyone like my dad, right? Or I don't want to marry, and then it's like, I married my dad. I hear that all the time, and then the tears that come along with it, especially when you're just like, I don't want to do that. But the reality is, what you don't heal, it continues to be attracted to you.
Mhm.
And so in our
That
intimate
energy.
relationships, we do play out some of the unhealthy patterns that are unresolved until we
Mhm.
address them. So I share
Mhm.
that because it's like, yeah, exactly what you said, and exactly what is talked about in that book, which is until we do the work, we continue to perpetuate the same cycles. And that's really
Mhm.
why doing the work, being a cycle breaker, generational trauma breaker, I'm just making these air quotes and having fun with it, but doing the work and healing those
Yep. Yeah.
childhood wounds and just the wounds, the emotional wounds, is critical in our ability to really increase our well-being and our health. That's what I
Mhm.
found
Yeah.
thus far, um, and is why I really love mind body medicine.
Yeah.
Wow, it's been a great
I think we
conversation.
come down to the wind down in the mind body work, that we may have to keep it to another time.
Yes,
But I think next time we should look into some of the different we've talked a lot about hypnotherapy, I think this time. But in mind medicine is bring that out maybe either next time or another time here in the future for our listeners, because this to me, I just in my doing coaching and practices of seeing that this is kind of the roots of getting to that, again, that health and wellness. You can get the food, you can get the nutrition, like you said, or the exercise, but if we don't work on that mind body piece, the stress management piece is kind of what I call it. then it's safe. Like you said, there's people, the physique says, why do you have hypertension? Why do you have type 2 diabetes? You know, and it comes down to that piece, that healing of the mind and the body and bringing it back into balance and stuff. So there's many ways we can address it. We spoke about another one earlier, but I won't get into that one.
Next
But
time. Yeah, I think we can
definitely,
definitely do that. Next, like in our next episode, we can talk about other modalities. Yeah,
yeah.
today, I mean, I'm glad that we like I love talking about hypnotherapy, but like hypnotherapy is only one aspect of mind body medicine,
Right.
and there's so many modalities that we incorporate into our practices that support the mind body continuum.
Yeah,
So,
and I know you've
oh,
got some great ways. Sorry, I was going
no,
to
go ahead.
say you you do hypnotherapy, but you've also got ways that you can start. It's kind of an art where you can actually incorporate other things with it to make it that much more robust for your patients.
Yes, no, that is so true. So next week we can talk about not next week, our next episode.
Yeah.
Our next episode will dive a little deeper into other modalities that we
Mhm.
use and continue to discuss some of the science behind what we
Mhm.
do and how we kind of get onto or into our practices and the experiences, the clinical experiences and the outcomes that we are seeing by
Mhm.
integrating mind body medicine into naturopathic
Mhm.
medicine and traditional Chinese medicine as well as health coaching. So, yes, thank you so much
Yep.
again, Joanna Mickel, health empowerment coach.
Thank you.
Yes, so we'll
Yay.
see.
Thank you, Dr. Ma.
And thank you all listeners for tuning in for our third episode. We look forward to continuing to share the mindful table and creating space where we can have these kind of conversations that always get a little deep and meaningful,
Yes, full of mindfulness.
full of mindfulness. All right, thank you.